Hello, everybody. Good evening. Hope you all are doing well. Okay, so my name is Rimi, and I'm a yoga trainer by profession, and this is the first time I'm going live on YouTube. And in today's video, I will be talking about PCOS, irregular periods, and how yoga supports our hormonal health. All right. So I will break down the video in different sections and different segments. I will start by talking about PCOS and I will help you understand that why do our periods become regular. I'll give you a deeper picture of, what is happening within our body, and we'll also understand the hormones that are involved in this process and how yoga helps with PCOS medically. All right. So, first, let's start with understanding what is PCOS. All right. So, PCOS, also known as polycystic ovary syndrome, it is a hormonal and metabolic disorder. So, I'll tell you what typically happens in PCOS. So, in PCOS, ovaries may not release eggs regularly. There are small immature follicles that appear when you go for an ultrasound. Then we have this hormone called androgen, which is a male hormone that becomes higher than normal. And the last one is insulin resistance is very common. Okay. So when a combination of these things happen, it disrupts the normal menstrual cycle. Now let's understand why do our periods become irregular. Okay. So normally what happens every month is our brain sends signals to these two hormones, which is the LH and FSH hormones. Okay. So when that happens, the ovary matures an egg. That's when ovulation happens, progesterone rises, and the periods come regularly. Okay, so this is what is supposed to happen every month. Okay, now when you have PCOS, what tends to happen is FSH and LH, the ratio gets disturbed. Ovulation does not happen regularly. Progesterone remains low. Estrogen may stay high without balance, and because of this, the cycles become delayed, skipped, and unpredictable. All right. So, hormones, it is basically our hormones that get very, very disturbed. All right. So, now let's understand the three main hormones that are involved, and I will give you a simple medical breakdown. Okay. Now, the first one is insulin. All right. So, many women who have PCOS have insulin resistance. So, this means that the body produces insulin, but your cells do not respond properly. All right. So, when the insulin is high, it stimulates the ovaries that produces more androgen, and this leads to acne, facial hair, hair thinning, and irregular periods. Okay, that's number one. The second one is androgen. Okay, so when the androgen levels go high in our body, it suppresses ovulation and it disturbs the follicles. So eggs don't mature. All right. And the third one is cortisol, which is the stress hormone. So chronic stress, जब हम बहुत ज़्यादा स्ट्रेस लेते हैं उससे कॉर्टिसोल बढ़ता है. कॉर्टिसोल इज द स्ट्रेस हार्मोन. ठीक है. सो हाई कॉर्टिसोल से जो इंसुलिन रेजिस्टेंस है दैट गेट्स वर्सेंड and that also leads to a hormonal imbalance, and that is why stress management is very, very critical and imperative in PCOS. All right. Now let's understand what are some of the triggers and the most common root causes of PCOS. Okay, so number one, sedentary lifestyle. When there's not enough movement, when you're just sitting in front of the laptop, sitting on your couch, or you have a very lazy lifestyle, when there's not enough movement, okay, on a daily basis, um, that is not very good for your body and for your hormones. Second reason is when the intake of refined sugar and carbs gets very high in your diet. So when you're having a lot of sugary stuff, okay, that also can lead to PCOS. The next is poor sleep. After that comes chronic stress, and then when you have weight gain around the abdomen, another reason is inflammation in the body, and another point is gut health issues. Okay, this also leads to PCOS. All right, this is one of the factors. All right, now let's come into the next part where we'll understand how yoga helps PCOS medically. All right. So, first of all, you need to understand that when you start practicing yoga, it is not some sort of magic that is going to happen. But yoga it works through the neuroendocrine pathways. Okay. So, when you practice yoga regularly, what happens is इंसुलिन सेंसिटिविटी इंप्रूव हो जाती है बॉडी में. ठीक है. कॉर्टिसोल जो हमारा स्ट्रेस हार्मोन है that reduces. Okay, then it activates the parasympathetic nervous system. So our nervous system has two variations. There's a parasympathetic nervous system, two types. There's a sympathetic nervous system and there's a parasympathetic nervous system. So when our sympathetic nervous system gets activated, our body goes in flight and fight, which is our body tends a lot, all right, and that creates a lot of stress tension on the body, which causes all the problems that I discussed earlier. All right. But when you practice yoga, deep breathing, that activates the parasympathetic nervous system, which means your body feels more relaxed, more at ease, stress free, tension free. All right. The next, a very, very important point, it improves blood flow to the ovaries, the reproductive organs. Okay. Then it helps to regulate the hypothalamus, pituitary, ovarian axis. Okay, these are also hormones which are very play a very important role. So stimulation of this happens when we practice yoga. Okay, then it supports weight management, which is something that you have to look into when you have PCOS. All right, and practicing yoga overall, it improves your mood and your sleep as well. Okay, so all of this indirectly supports ovulation and your it makes your cycles regular. All right. Then we have some yoga asanas that we practice that are very helpful for PCOS. So we have Baddha Konasana, we have Malasan, there's Setu Bandhasan, Ushtrasan, Viparita Karni, Surya Namaskar, Bhujangasan. Okay. These are just names of yoga postures that are very helpful. Okay. Then breathing, yogic breathing exercises like Anulom Vilom, alternate nostril breathing, Brahmari, Kapal Bharti. Okay. So, and even just a simple like slow diaphragmatic breathing, when you practice all of this, it works on our nervous system and helps to activate the parasympathetic nervous system. Then, next we come into some lifestyle changes that need to be done. All right. So, number one is diet. So, when we talk about diet, we have to work on balancing our blood sugar. All right. So, we have to focus on protein and fiber. Okay. These two are very important. Okay. The next, you have to reduce the amount of ultra processed foods. Okay. जो हम ultra processed foods खाते हैं like biscuits, pasta, and any kind of food that is processed. You have to reduce the quantities of that. All right. Then you have to avoid excess sugar. You have to include healthy fats in your diet, and you have to maintain regular meal timings. That's also very, very important. Okay. Then the next part is sleep. 7 to 8 hours of sleep is very, very important. Okay. You have to make sure that you sleep before 11 p.m. So if you are sitting and scrolling your phone till late and spending endless amount of time on reels, on social media, which is leading to a brain rot, that is also giving signals to your mind that something is not right. Okay, so for hormonal repair, good sleep is very, very important. Okay, then the next important point is movement. So daily walking and yoga, very, very important for PCOS. All right, strength training also helps insulin sensitivity. All right, then the next part is stress. Mm. All right. So, meditation, journaling, digital detox, breath work, ये सब करना बहुत ज़रूरी है to manage your stress. Okay, so you can reduce your screen time. You can reduce the time that you spend on your Instagram, YouTube, Facebook. All right. Breathing exercises also help in managing stress. All right. Journaling is also a great practice. So when you journal, basically, when you start to write, it is a practice of unloading. All right. So whatever your mind does not need, sometimes when you feel that your mind is very, very chaotic, just start writing. That really helps. Okay. And meditation, I agree that a lot of people do not follow and understand meditation. All right. But try it, and once you get used to meditation, when you understand the process and how it works and how your body feels, it becomes a wonderful practice to include in our daily lives. All right. Now, towards the end, I would like to say that yoga and lifestyle support treatment is very, very important when it comes to PCOS. Okay, so this is not like the ultimate way to treat PCOS. Doctor consultation is very, very important. You have to get your blood test done, you have to get your ultrasound done, and you have to go with the medications prescribed. This is all extra steps that you have to take. All right. So I would like to end by saying that CPCOS is not a life sentence. Okay, it is something that can be managed with awareness, with correct movement, nutrition, stress management, and medical guidance. So your hormones can come back into balance. Okay, so whenever I take my yoga sessions, I have yoga sessions which are dedicated towards members who have PCOS. I focus on creating yoga routines that calm the nervous system, that improve metabolism, and support reproductive health. All right. So that is all that I had. That's to share about PCOS. Now, if anybody has any questions, you can put it in the chat box. And I will be coming live more often with different topics. All right. So I would be ending the chat now. Thank you for joining. Bye bye and take care.